Wait.
Hello everyone. Thank you for joining. We're back at Tuesday Tips. This is our weekly check-in. We discuss different topics in plastic surgery and I get to answer your questions. And today we're gonna dedicate this time for answering your questions. So I have a couple of questions already that you guys sent me, so I'll go over those. And if you have any questions, just put them in the chat. I'm gonna start with a very short topic, and it's actually answering a question that I had before, and I've had a couple of times, and I think it's a very good question, so I'll start with that one, and then we'll get to the previous ones that you had. So now we're seeing a lot of people using Ozempic, Mounjaro, semaglutide. These medications are actually medications that were made for diabetes, but one of the side effects or one of the actions in the body is that they decrease gastric emptying, so they're very good for weight loss, and we're seeing and I'm seeing a lot of patients now, massive weight loss patients from these medications. And one of the questions has been if I have to stop the medication. And the answer to that is yes. So like I said, the medication decreases gastric emptying, which is basically when you eat, the amount of time it takes for that food to pass the stomach. So when it decreases gastric emptying, sends a message to your brain that you're full faster and longer. So that's why it's a good weight loss medication, because it tells your brain that you're full and that you are not hungry for longer because the food stays there. But because I do the surgeries under general anesthesia, you know that for general anesthesia you have to have an empty stomach. So you have to be no eating for 8 hours before the procedure. But if you're in one of these medications, 8 hours is not going to be enough. You're still going to have food, and you're still at risk of aspiration, or having that food in your stomach go to your lungs when you're getting the tube from the general anesthesia. So the recommendation is to stop the medicine 2 weeks before surgery, okay? So that effect of the medication goes away, and when you go into general anesthesia, the effect of the medication is not in your body. And when to restart it? It's good to restart it at least 30 days after the surgery. Why? I don't want you dieting. I don't want you calorie restricting yourself after surgery. I want you eating and recovering from the surgery. So after surgery, it's not a time for weight loss. It's not a time for calorie restriction. It's actually time to eat and recover. So don't start it until 30 days after. After that, everything is healed, you're recovered, and then you can restart the medication if you wish to. And the other question I get commonly about this is, we've heard a lot about Ozempic face, and people ask me, if I had a BBL, can I start Ozempic or semaglutide? Okay, let's talk a little bit about that. So you know that when you do a BBL, I'm transferring fat from one area of the body to the other. So I'm transferring the fat that you have in your belly, in your back, to the buttock and hips. That shape and that volume is in the weight that you were at that time. If you lose weight, then like any weight loss, like if you lost weight before the BBL, you were gonna lose the fat in your belly, right? So now you're gonna lose the fat in your buttock and hips because it's the same fat, okay? So a 5 to 10 pound weight loss is not gonna affect drastically your results, but if you lose more weight than that, then yes, you're gonna see a reduction in the buttock and hip area of the fat transfer areas. And that's basically the same concept of Ozempic face. What's Ozempic face? Deflated. It's basically you're losing fat, you're losing weight, right? The fat in the face, in the cheeks, in the upper area, you lose it, and that's why people look deflated. It's just weight loss, you're losing fat. So be careful if you had a BBL and you want to use it, just be mindful that your results will change, okay? I'll get some more questions now.
Okay, Dr. Vidal, do you have any procedures for varicose veins?
Varicose veins. I don't have any procedures right now. Varicose veins is something that should be evaluated by a vascular surgeon. Varicose veins is actually a result of problems on your deep veins. Usually we have two systems of veins in our legs, superficial and deep, and those veins have valves, okay? So those valves are the ones that keep the flow of the blood back to your heart instead of going into the dependent portions of your legs. If those valves are not working well, then the blood accumulates more in the legs and it causes swelling, it causes varicose veins. So those veins kind of dilate and engorge, okay? So it's very important that if you have varicose veins, I know that we don't like them aesthetically, but we have to check with a vascular surgeon and with an ultrasound of your legs to see what's the cause. And usually, and sometimes you'll need other procedures like laser, RFA treatments on your veins to kind of improve that. And something that nobody likes to use, the compression socks are actually the treatment for this. I wear them every day. So, I mean, they're not the most comfortable things, but they do help with decreasing the varicose veins.
Okay, let's go to the second one.
Yes.
It's in Spanish.
Okay.
¿Es recomendable un tummy tuck para una mujer de 60 años?
Claro que sí. El tummy tuck se puede hacer en una paciente de 60 años. Lo que es, si tienes las indicaciones, ¿qué hace un tummy tuck? Remover el exceso de piel en la parte inferior del abdomen, también corrige la separación del músculo, así que aplana el abdomen y trae tu cintura hacia adentro, y también hago liposucción en el área de la cintura para acentuar más la cintura.
Que si lo puede decir, por favor, en
inglés. So the question is if we can do the tummy tuck in a 60-year-old. The answer is yes. The patient needs to have the indications of it. The tummy tuck, what it does is removes the skin in the lower part of the abdomen, repairs the abdominal muscles, and also liposuction the flanks to accentuate your waist. Obviously, the 60-year-old needs to be healthy, okay? So, or if you have any medical conditions like high blood pressure, diabetes, be under control, okay?
Unfortunately, I'm unable to lower my current weight before my surgery. My BMI is 38. Any advice?
So it's very important that you lower it before the surgery. There are different things that you can try, but I advise you meet with a nutritionist. So sometimes we try to lose weight on our own, especially now I'm trying to lose weight, my baby weight, and it's very hard, I'm not gonna lie. So sometimes we get frustrated and we actually don't know what we're doing wrong. And to meet with a professional, sit down, go over every single thing, your breakfast, your lunch, your dinner, what is it that you're eating every day? And maybe it's not eating less. Sometimes it's eating more times, less amount. It's different things that we need to do, and the actual meals that you're having. So meet with a nutritionist is very important. Why? Why do I need to bring your weight down? Because the complication risks are too high if your BMI is over 35, okay? Risk of wound healing problems, risk of wound dehiscence or opening, risk of blood clots, okay? So it's not advisable to have surgery when your BMI is that high.
Okay. Could you explain a little bit the process to get a consultation?
Of course, very, very easy. And the consultation and quote is free, so you don't have to worry about that. So you go to our website. If you go to my Instagram page, there's a link there. Just click that link and it'll take you to our website or pureplasticsurgery.com. When you open that browser, there's a virtual consultation form or a tab that says request consultation. If you click that, it'll open a form. The form is very simple. It's like some demographics, some questions about your past medical history, and it'll ask you for 3 pictures. That information and those 3 pictures are sent to me. I evaluate it, and I'll let your coordinator know what are the recommendations. Your coordinator will be in contact with you with the quote and my recommendations.
Doc, Valentinides is requesting to be in your live video. You don't want to say hi?
Of
live?
course, let's do it.
Let's do it. And we have like 4 minutes for her.
Yes.
Okay? And with that, we can close this live. Okay, it's coming, Valentinides. Could you explain a little bit who she is?
Of course, this is a beautiful patient of mine.
Hello.
Hello.
You can see her right now, but she's with you.
How are
Good to
you?
see you. I am so good and happy with my results.
That's awesome. How far along are you already?
my surgery and my procedure came out. It's beautiful. You have no idea. I thank you so much. You're the best.
Thank you for joining, and I'm super happy for you. And it's only gonna get better. You see, like you've seen the amount of swelling has come down significantly. Now
It's beautiful.
that's awesome. And the scars will continue to get better up to a year. So wait for that.
Okay. Great.
Thank you so much for joining.
You're an awesome doctor. Bye-bye.
Okay, bye. Bye. Okay, well,
Awesome.
Let's go to the last question for
Yeah.
today.
Let's do it.
And it's, after a lower back lift, how long do I have to wait for a BBL and Lipo 360?
So if you had any type of excisional surgery, so upper back lift, lower back lift, tummy tuck surgery, you should wait at least 3 to 4 months to have lipo, okay? But if you had lipo and you want to do another lipo case, then you should wait longer, because the scarring of liposuction takes actually longer to kind of soften and heal. So if it's like an upper back lift or lower back lift and if you want lipo, 3 to 4 months. If you had lipo and want another round of lipo or BBL, 9 months to a year, okay? That's it. I loved it. Thank you so much. Thank you, Valentinides, for joining. And love the questions. You can continue to send me questions to the DM, and I'll see you guys next Tuesday with Tuesday Tips.